It is a video that is extremely personal.
Our fears are dancing between us.
Yeah, open, running.
A woman's private pain examined for scientific research.
That is so healing.
Instead of holding us down.
She's on one of America's most popular party drugs. Forget what you've heard about Molly, X, or MDMA.
It makes you feel euphoric, happiness, love.
What you're about to see is the intersection of therapy and science, and a journey to find the truth about MDMA.
This is TechKnow, a show about innovations that can change lives.
The science of fighting a wildfire.
We're going to explore the intersection of hardware and humanity, and we're doing it in a unique way. This is a show about science.
Oh my God!
By scientists.
Tonight, TechKnow investigates Molly.
Hey guys, welcome to TechKnow. I'm Phil Torres. MDMA, Molly, X, call it what you want. This drug is offering some intriguing and even surprising potential in both the military institutional perspective and medical scientific. And that's why I'm joined by TechKnow's Lindsay Moran and Cara Santa Maria, who can explain it from a neuroscience perspective. Now, I've seen Molly as a club drug, but as a therapeutic drug?
The military once used this as what they imagined could be a truth serum, and now there's evidence that suggests that it could help PTSD sufferers.
Yeah, and you know, scientists have long been intrigued by the sort of empathic benefits of MDMA, but now for the first time, there's an FDA-backed study so that they can see if these results are scientifically quantifiable.
This serene treatment room nestled in the woods of South Carolina couldn't be further than the pulsing lights and booming music at this electronic music festival. At festivals and nightclubs, the illegal drug Molly, or Ecstasy, is part of the culture. Called Molly or X on the street, MDMA is really methylenedioxyamphetamine. It's a psychoactive drug first developed as a blood clotting agent, later patented as a diet drug. When taken, MDMA acts on the brain by causing neurons to release more serotonin. This also causes the neurotransmitter dopamine, as well as hormones like oxytocin, to be released, all leading to a heightened feeling of trust and compassion. This is why MDMA is often called an empathogen. A Hollywood club goer explains.
I think people like taking MDMA because it makes you feel euphoric. It makes you feel like your anxiety is released, feelings of happiness, and you can't talk about MDMA without talking about love, and that's essentially why people take it.
And maybe that's something I can take in the rest of my world, just be around moms.
And although this clinical setting is a world away, patient Rachel Hope just took the illegal drug MDMA.
I was very anti-drugs, a teetotaler. I had seen what drug use had done to people in the 70s. I blamed a lot of the things that had happened to me on people's drug and alcohol abuse.
Rachel spoke with TechKnow from her new home in Berlin. She's hopeful she's put her difficult past behind. Rachel says as a child she was severely neglected, and by age 6, she'd been sexually abused. In the 90s, she was diagnosed with PTSD, although back then, she says, they called her condition acute anxiety.
I spent up to 6 weeks at a time hospitalized or in clinics specializing in trauma. No matter what anybody did or gave me and how motivated I was highly compliant. I finally told this therapist, I said, I'm doing everything you told me to do. I'm doing everything right. Why am I getting worse? I was hysterical. And he said, because we have no cure for PTSD.
Still, for more than 16 years, she tried conventional therapy. In 2005, Rachel applied for and became part of a revolutionary study. She was one of 23 patients to undergo MDMA-assisted therapy. She was initially a bit hesitant.
I also believe, like most people, that this medication puts holes in your brain and it can't possibly do anything.
TechKnow's Lindsay Moran traveled to South Carolina to meet with Dr. Michael Mithofer, the psychiatrist who led the MDMA study.
The clips you're about to see may look like a standard therapy session, but Rachel Hope had just been given 125 milligrams of pure MDMA. Rachel gave TechKnow special permission to view these never-before-seen clips. She also gave the Mithofers permission to discuss her therapy session.
But maybe being willing to let go of trying to understand for a few minutes.
In this videotape session, Rachel shares what she says was a difficult relationship with her mother.
Why didn't she want anybody else to have me either?
With the MDMA, I was able to connect with these really primal and scary, helpless feelings of what it was really like to have the mother who brought me to life truly not love me or want me.
What was wrong with me? How come every mom feels that way, but not me?
Because it wasn't about you. It wasn't something wrong with you.
How could it not be? She wanted other people.
You could feel that something was wrong even before you were born.
It was painful and hard, and I felt all these feelings of being a helpless little child, just wishing and hoping that this person would love me, and going, what is wrong with me? I mean, you can go into some of these wounds with hypnotherapy, but it's not going to change you the way MDMA allows you to go into the depth of the experience of a pre-verbal, precognitive wound.
Treating PTSD virtually always involves revisiting the trauma in a therapeutic setting. And if they're not emotionally engaged enough, then the therapy doesn't work. So we think that MDMA seems to have this interesting combination of helping decrease fear and defensiveness at the same time. So people are not numb from their emotions, but they're not overwhelmed by them either.
Well, just now, when I was talking with you, I was feeling connected to you, and then there was this little, like a flare of fear that went up, and then I decided I'm gonna ignore it. I don't want to deal with it. But then,
Fear from me?
yeah. But then the medicine's like, nudge, nudge, nudge. Just go check it out. You know, you don't have to pick it up. You can just look at it for a minute.
What would be something to be afraid of? What would there be there that would be fearful?
That I wouldn't be enough. That you would expect more.
This would be my fears, that I couldn't be enough. I couldn't match your mind and your thoughts, and yeah, very similar.
Wow.
I couldn't keep up, or...
Oh, this is so great.
Mm-hmm.
Annie,
so see how we can both have fears?
Annie, our fears are dancing between us.
Yeah.
They're making art.
Mm-hmm. They're out in the open running around, right?
Oh, God. That is so healing.
Instead of holding us down.
Oh, thank you so much.
Well, thank you.
Why is that such a significant moment?
In the beginning, she says, I feel connected with you, which we were talking about the way MDMA helps with the therapeutic connection. But it wasn't just that everything was fine and she wasn't feeling anything else, because then very quickly she was able to recognize, consciously have clarity about the fact that other feelings were coming up, including fear, and she was able and willing to express that rather than try to move away from it.
But establishing trust between doctor and patient is essential.
I realized that I had so many guards up in relationship to women. I had a very hard time making bonding, lasting, like sister friendships. So I wanted to work on that with Annie Mithofer.
Rachel says she saw almost instant improvement after the MDMA-assisted therapy. Although it's key to remember, she, as well as all the test patients, did undergo extensive post-sessions to process the emotions the MDMA dug up.
It's not just what happens during the MDMA effect. A process, it's an experience that continues to unfold, so it's important to have proper support to help people integrate and continue to benefit from the experience.
In July 2010, Dr. Mithoefer published the findings from this first phase of his study in the Journal of Psychopharmacology. A positive clinical response occurred in 83% of those patients given MDMA. That's in comparison to the 25% found in placebo patients.
So we often have the sense, well, maybe a couple years worth of therapy just happened today. So there's something about the MDMA that seems to help a lot happen in a short period of time.
Today, Rachel insists she has completely recovered from PTSD and is living a healthy life with no long-term side effects.
How is that possible?
It makes sense that if people can have a deep enough experience of coming to terms with trauma, you can argue whether it's a cure or a durable remission, but in any case, she doesn't have the symptoms that would qualify for the diagnosis of PTSD anymore.
The Mithoefers received enough funding to enter a second phase of testing. This time, a test group of war veterans with PTSD participated. The results from this study will be submitted to the FDA. Their long-term goal is to study whether MDMA should be reclassified by the FDA so it becomes legal for medicinal uses.
I think the rational thing to do is learn everything we can about the possible risks and benefits and act accordingly, not to put it in a separate category just because it's been used recreationally.
The drug was given orally to the men in the hospital ward at 11:15. And they immediately imbust, arriving at the exercise area 10 minutes later. At 11:40, the first effects of the drug make their appearance. The men no longer take cover, they relax and begin to giggle.
This British Army experiment was filmed in 1964. The effects of psychedelics on humans has been tested officially and unofficially for at least 6 decades.
The troops have lost their air of urgency, and many men are laughing.
The U.S. Army conducted their own chemical warfare testing using soldiers as test subjects during the same period.
2 hours later, the squad, all except the drill sergeant, now drugged with LSD, again was ordered to fall in. The response was not the same.
The American government was trying to determine if LSD could act as a truth serum. Perhaps most troubling was a covert operation cooked up by my former outfit, the CIA, codenamed MK Ultra. According to agency documents officially declassified in 2001, from the 1950s until at least 1964, the agency was secretly dosing inmates and also using prostitutes to lure Johns, whom they could then unknowingly drug. They then observed their behavior in what was essentially a government-sanctioned mind control study. While the US government was attempting to use psychedelics for their benefit, secretly scientists were also using them on the academic side. TechKnow's Cara Santa Maria met with Dr. Charles Grobe, a pioneer in the therapeutic use of MDMA and other psychoactive drugs. She visited his high-security lab at the Harbor UCLA Medical Center.
In a safe that's bolted to the ground behind one locked door and then behind this other one here, researchers at Harbor UCLA Medical Center keep their MDMA under lock and key, literally.
Grobe says that as controversial as the drug is today, it wasn't initially viewed as an illegal street drug.
Research with psychedelic compounds in the 50s and early mid-60s was really the cutting edge of psychiatric research. There was great excitement and enthusiasm about the range of effects of these drugs, how they might facilitate our understanding of the brain. Unfortunately, by the mid-late 60s, it was became associated with a politically active counterculture.
Recreational use of psychedelics was on the rise. So were overdoses and deaths associated with them. So Dr. Grobe says that pressure against psychedelic research began to build.
There was a great deal of cultural upheaval, and by and large, primarily for political reasons, all research by the early 70s was repressed.
For years, MDMA had flown beneath government regulators' radar. In 1984, the DEA began investigating whether it should be classified as a Schedule I drug, meaning it has no medical use and high abuse potential. A year later, under the Controlled Substances Act, MDMA was added to the Schedule I list. Dr. Alicia Danforth, a psychologist and researcher who studies psychedelics, explains the impact.
Research has been hindered because MDMA was put on Schedule I and putting it in the most prohibitive class of controlled substances. And a lot of research that could have taken place since it was scheduled in the mid-'80s has been postponed. So there are some things that we know about MDMA, but there's a lot more to learn.
By 1986, a growing number of psychedelic researchers had begun to lobby and even sue the federal government. The Multidisciplinary Association of Psychedelic Studies, or MAPS, was born. Rick Doblin, self-proclaimed hippie-turned-advocate, researcher, and fundraiser, began his mission.
It became apparent to me that the only way back into legal use of MDMA would be through the FDA, would be to medicalize MDMA through scientific research.
Launching MAPS into a 30-year struggle with federal regulators that's resulted in small but privately funded MDMA studies across the world. It's Friday night in Hollywood. The dance clubs along Hollywood Boulevard are starting to fill up with partiers. Molly is part of the scene.
Hey, hey.
A team of volunteers from a nonprofit called Dance Safe has hit the streets too. As members of the harm reduction movement, they're on a mission that they think is very important.
So you use this term harm reduction. What does that really mean?
Well, harm reduction is acknowledging the fact that despite zero-tolerance drug policies, people are still going to use drugs. So the end goal is to keep people safe, alive, and really prevent overdose and death.
Having attended hundreds of concerts across the country this summer, they know firsthand it's been a deadly festival season. In several states, high-profile media reports of overdoses and deaths associated with drugs, often mistakenly called Molly or X, underline the importance of their work.
Yeah, I had a buddy actually die at last year because he ate some bad drugs that someone told him was LSD, and it was like some research chemical knockoff. They actually put 30 people in the hospital and killed 5, and that really brought my awareness up.
This anonymous festival goer's experience is not unique among those who admit to taking Molly or X. Independent private testing group Eurowid has collected data. By offering anonymous testing of samples, they've been able to track how often street pills sold as Ecstasy or Molly actually have MDMA in them. Of the almost 3,700 samples submitted so far this year, they found just 27.5% of the time it was pure MDMA. So DanceSafe volunteers are armed with information about the dangers of taking unknown substances, and they even carry self-testing drug kits. They will test anyone's drugs on site, for free, no questions asked. They let me try a kit for myself, using a sample of a white substance a volunteer found lying on the ground at a rave.
So the DanceSafe test kit is really simple to use. You're gonna wanna take a really tiny amount of the unknown substance and scrape it onto any white porcelain surface. Now there are 4 reagents involved to help you really narrow down what your possible substance is. So 1 drop is all it takes. And the reaction will occur within 5 to 30 seconds max. It looks like it's kind of an orangish color. So it's possibly either methamphetamine or amphetamine.
The problem with Molly is significant, and not just in Hollywood. Cities across the US are seeing a rise in substances called Molly or X on the street. In the last year, the DEA has also seen a huge spike in synthetic drug imposters posing as Molly. TechKnow's Lindsay Moran has that part of the story.
We're just outside Washington, D.C., at the DEA's Special Testing and Research Lab. This is where drug seizures and samples from all over the world are sent to be chemically identified. Jill Head is a supervising chemist at the lab.
Every drug exhibit that's submitted to the laboratory is approached as a complete unknown. We don't suspect that it's anything until we conduct our analysis and make an actual identification.
The lab tests thousands of drugs each year.
She has 2 materials, and they are both white powders, and so they're going to both be prepared in the same way.
Most are evidence collected during seizures. Using the most advanced equipment in the world, it's still a challenge identifying the constantly changing chemical compositions found in synthetic imposters.
And we've determined that it's methylone.
Do you ever test something and lo and behold it's pure MDMA? Or is it typically not?
We do analyze and identify pure MDMA. We do, however, also identify it and it's something completely different.
But DEA spokesman Rusty Payne is quick to debunk an MDMA myth. Some people have the perception that MDMA, if it's pure, isn't dangerous. What's the reality?
There's no such thing as a good batch of drugs versus a bad batch of drugs. Ask the parents of the dead kids.
To a certain degree, leading MDMA-assisted therapist Michael Mithofer agrees. His samples are kept in a safe. He stresses MDMA should always be given to patients while they're under psychiatric supervision, so their physical and mental states can be closely monitored.
It's important to note this is not take-home medicine. People only receive MDMA, depending on the protocol, about 3 times a month apart under direct supervision.
And while the DEA is in charge of enforcing penalties against those who use MDMA or ecstasy outside approved clinical research, the agency takes no official stance on it.
Our job is law enforcement. We leave the medical and scientific decisions to doctors and researchers and scientists. You don't want cops making decisions about what should be medicine and what shouldn't be medicine.
I gotta say, this one really fascinates me because it's something that scientists have wanted to study for decades, but there was a taboo out there holding them back from it, and laws that were holding them back from it.
Completely, and I think that this is a really important point to make. Even though when you're under the influence of a drug like MDMA, you feel more open and more connected and really empathetic with the people around you, it's a fleeting experience. In a therapeutic context, though, this can be used to the therapist's advantage. It's not about pop a pill, you're gonna get better. It's really kind of an assistive property to the therapy itself. And I think that's the important point to make, that with or without the MDMA, the therapy is going to happen. The MDMA potentially can help it happen a little bit more quickly.
Maybe break down some of those barriers.
Exactly.
I think it's going to be a long time before we see something like this as, say, the go-to treatment for people suffering from combat trauma. I mean, we've covered for TechKnow some other experimental treatments for PTSD, like virtual reality and hyperbaric oxygen chamber treatment. I have to say, it'll probably be a while before the VA is willing to delve into this kind of treatment, just because of the conceptual taboo.
Well, thank you guys for sharing both personal experiences and what you saw doing this piece. Now, MDMA is certainly going to keep presenting a challenge for law enforcement and medical researchers, so we're going to keep an eye on this story. Thanks for watching TechKnow. Catch you next time.
Dive deep into these stories and go behind the scenes at aljazeera.com/techknow. Follow our expert contributors on Twitter, Facebook, Instagram, Google+, and more.